So now let's go in a little bit more detail, and we're going to talk about one of the two big components of oropharyngeal dysphagia, which is structural abnormalities. And the disorder that we're going to talk about is called Zenker's diverticulum. Okay, Zenker's diverticulum was first described by Dr. Frederick Albert von Zenker. He lived from 1825 to 1898. He was a German pathologist. He published a series of patients with this disorder and described its anatomic pathophysiology in 1877. Here's a picture of Dr. Zenker. So let's talk about the pathophysiology of Zenker's diverticulum. Zenker's diverticulum develops when there is over tightening of the cricopharyngeus muscle, causing the throat above it to pouch out. The outpouching occurs in the posterior pharynx above the upper esophageal sphincter. In rare cases, the diverticulum can even be larger than the lumen of the esophagus itself. The patient is going to have dysphagia to both solids and liquids. It is primarily seen in elderly individuals, usually between 60 to 90 years of age, and it's rare to find a Zenker's diverticulum before the age of 40. And it's more common in men than in women. So I'm going to show you some pictures which are going to highlight this pathology very, very clearly. And let's take a look at this one. So this is a barium swallow in a patient who has a Zenker's diverticulum. And what we're going to do is we're going to follow the barium as it goes down the esophagus, and it will highlight the Zenker's diverticulum for us. So as you can see here, this patient has taken barium, and the barium is going down the esophagus, and this structure, which is becoming opacified, if I move down a little bit more, you will see that this structure that's getting opacified as the barium is traveling down the esophagus, that's Zenker's diverticulum. And ultimately now you are seeing that the barium is actually going down the esophagus here. There is still barium in the Zenker's diverticulum, but some of it is making its way down the esophagus, and it goes down the esophagus and passes into the stomach. Let's look at a lateral. This is a lateral film, and here you can see very clearly that this structure is Zenker's diverticulum. And also this is another image where you can clearly see the barium going down, and this structure right here is the Zenker's diverticulum, and the barium goes down the esophagus all the way into the stomach. So Zenker's diverticulum leads to accumulation of food in the pouch, which then is regurgitated several hours or even days later. Patients usually have halitosis or bad breath, aspiration, and difficulty swallowing. They usually describe a long history of dysphagia followed by a sensation of food stuck in the throat. The best diagnostic test for Zenker's diverticulum is a barium swallow with video fluoroscopy. We do not perform upper endoscopy in patients suspected to have Zenker's diverticulum because of the risk of perforation. The best treatment modality is diverticulectomy with cricopharyngeal myotomy. Must do both, otherwise there is a risk of recurrence of the lesion. Since most patients are older, careful selection must be made. If the patient is not a surgical candidate, botulinum toxin can be injected into the cricopharyngeus muscle to help relieve symptoms of dysphagia. So we already talked about that Zenker's diverticulum pathology is over tightening of cricopharyngeus muscle. So if we give botulinum toxin in the cricopharyngeus muscle to paralyze it, that can help relieve the symptoms of Zenker's diverticulum associated dysphagia. Next